Thank you, Dr. Evans, and really thank you on behalf of the Chicago Department of Public Health to everybody who's here this evening. I had just a lovely series of conversations with folks before we got started. I want to just say also welcome to the new fellows. It seems like an amazing organization with such a storied history of leadership here in Chicago, and I know there's been a long history of partnership between IOMC and the Department of Public Health. We have multiple folks who have been on the Board of Health, and we really want to welcome you into the community. And I also want to pose a little bit of a challenge to you. It's an exciting time to be in Chicago. As you know, Mayor Lightfoot has been talking about public health approaches to violence. She's been talking a lot about health equity. And at the Chicago Department of Public Health, as you all know, we've tried to put this laser focus on health equity, especially through Healthy Chicago 2.0. And I know that your organization also has really been using these terms and thinking about how to promote equity in your own work. So thank you for your partnership and for the ongoing work in this space. But we are not done. I know everybody in this room is aware of the 17-year life expectancy gap between one community in Chicago and another. What you might be less aware of is that since 2012, across the whole city of Chicago, we've actually seen a half-year decline in life expectancy across the whole city. So currently, life expectancy is 77.3 years, down from 77.8 years. And even more concerning, even with all of the work we've been doing, the life expectancy gap between non-Hispanic Black Chicagoans and non-Hispanic white Chicagoans has increased during that time period by 22%. So at CDPH, we've been doing a lot of work to understand that gap and really try to put a more laser focus on it. And I want to just very briefly let you know the 5 main things that are driving that gap so that collectively we can work together on addressing it. 8.8 years. The biggest contributor, no surprise, chronic disease, cardiovascular disease, especially those related to obesity. That accounts for about 3.8 years of the gap. Next, homicide. 2.1 year difference in that gap. Next, infant mortality. 0.7 years. Next, still HIV and infectious diseases. That's about 0.5 years. And then rounding out the top 5, opioids. We have more people, hundreds more people dying of opioid overdoses than we do of gun violence here in Chicago every year right now. So we are continuing to track the outcomes of Healthy Chicago 2.0, don't worry, but we are adding, with the new mayor in place, coming this fall, a Healthy Chicago 2025 focused especially on these five issues that are driving a lot of that mortality gap. But finally, with all of you, we're trying to also get even more serious about the root causes of these health inequities. So what affects mortality? Disease and injury, the bread and butter of medicine and of healthcare. What affects disease and injury? Risk behaviors, the traditional bread and butter of public health. But then if we start backing up a little more, what affects risk behaviors? Fundamentally living conditions. So this is thinking about physical and social, economic and service environments, and I'm really excited to hear the presentations that are going to be coming next and talking about that. And then what affects living conditions? Institutional inequities and ultimately social inequities related to race and ethnicity and class and gender and sexual orientation. There are no easy answers here. This is hard space for the health department and for those of us who are leaders in health across the city of Chicago. It's hard to start talking about more of these upstream causes, but we think that health and we think that life expectancy is a productive lens to start having these difficult conversations. So together with you, we have a lot of work to do. You've done amazing work in 104 years, and we at Chicago Department of Public Health are really excited to continue partnering with you. We need to see progress in this area, and I know together we will make progress. So welcome again to the new fellows, and thank you.